Hi, welcome to the Dr. Lisa Soul Senti podcast. I'm Dr. Lisa, and I'm so happy you're here today. We are talking about MTHFR, and we're doing an MTHFR podcast series. It's one of the most common questions I have about how to, what is it, how to interpret the lab results, and, what's the impact it has on, my life, my child's life. So if you have not done so already, please go back at some point and listen to part 1 and part 2 in the series, because I go over all of that. I just went over what MTHFR is, how to get tested, what it looks like on the lab results, what are the variants that you can have, what each of them mean, the verbiage that they use that you'll see if you're researching and you're learning about it. I also talked about in the last podcast is how it's linked to health problems and what that means, what the impact it has on the body and what that means for you. And all of that beauty is leading to today's podcast, which is me sharing my protocol with you, which this is just golden, because this is something that, I give to you when you pay to meet with me. So I'm giving it to you on a podcast. Again, it is not meant to treat. I'm not treating you on this podcast. This isn't to replace any medical care. This is just golden educational information for you to understand what to do if you have this MTHFR, mutation, and some of the steps that you you must implement. And we're going to talk about why in a second. I do suggest, before I get into this, that you do meet with me, because I'm very good at interpret this. I'm an MTHFR expert now. I've been doing this for years, and it's very hard to learn. I can't express that this isn't anything I learned overnight or I learned within a month. So this is something that, it's years of me learning and incorporating. And again, a lot of this stuff is clinical for me. I'm all about what I see in my clinical practice. So it's what I've worked with patients, what's worked, what hasn't worked. Although everyone's different, you start seeing patterns. So you start saying, okay, I'm also a brand snob. I'll find out which product works, which products don't work, and we tend to stick with the ones that work. So that's what we're all about here. So definitely, if you have MTHFR and you're learning about this through the podcast, book a consultation with me. If you're already a patient, book a follow-up with me. The follow-ups are probably the most important thing when you're trying to get yourself well. If you're not booking follow-up visits, you're not proactive in getting well with functional and alternative healthcare. It's very different from medicine, where we just don't treat your symptoms and you take a pill and it goes away. We're all about making sure the systems of the body are working. So when you're moving forward with your age and your life, that they're working properly, and some of these diseases and illnesses you can prevent. And if they occur, you're also going to work on supporting systems to help your body deal with them, possibly reverse them and overcome them. So it depends on what you have and the limitations of matters that exist with it. Okay, let's get into my protocol. This is super, super exciting. So because the compromise with MTHFR can be severe, it can have some severe consequences, which meaning you could be at more risk for things not working, not going well in the body. It's important to focus on good sources, the natural sources of folate. I can't express that enough. I know it sounds so simple, but think about this. If your MTHFR mutation isn't allowing you to convert folic acid to folate, we talked about that equation. Folic acid has to get converted to folate, and then you need folate for all these other things we talked about. And we talked about B12 and B6, and we talked about glutathione and homocysteine, and the impact all of these things have. I mean, I didn't even talk about all the impacts that B6 and B12 and folate have, but we talked about a little bit of some of the chronic illnesses that we see. I'm going to get into a little bit more about B12 and B6 as we move forward. But what I need you to know here is that if the seesaw, right, is unbalanced now, the equation's unbalanced, and you have a lot of folic acid in your body because you're eating it from foods and taking it in from medicines, or not medicines. It could be in some medicines, a prescription form folic acid, but I meant to use the word vitamins or supplements. And you're getting this toxic buildup of folic acid problem. That's definitely a problem. There's lots of symptoms for that. You also are going to get a folate deficiency. So the number one step in my protocol is to avoid the folic acid, the FOLIC, at all costs. So we don't get this toxic buildup of folic acid. So that's the first step. It's pretty simple. I'm telling you, these steps make sense. and they're easy, but they're like, they could be life-saving or life-changing. So the first step, identify your foods and your supplements. Go through your supplements that have the word FOLIC, and don't eat them. Because if you're having the MTHFR mutation, and definitely you have more than one, so if you have like 2 out of the 4 or 3 out of the 4, you definitely have to do this. If I had one, I would do this anyway. And just avoid it because you're not maybe converting folic acid. So that could be a problem. We don't want it to build up. Begin by reading nutrition labels on the foods and the supplements. And what you want to see is you want to see the natural form. You want to see L5 methylfolate. Sometimes it's 5L methylfolate. Sometimes it's, they'll say 5 MTHFR. You also want to see that B12 is in the methylated form, methylcobalamin. You do not want to see cobalamin by itself. You want to see methylcobalamin. So remember I told you in the other podcast is look for the word methyl. So methylfolate and methylcobalamin. It's basically the most natural form you can in these supplements of folate and B12. So these are the safe forms for MTHFR. Methylfolate and methylcobalamin. You want to avoid the folic acid. And so those are the 3 words you have to understand. The second step is to eat natural folate. So you want to include the foods in your diet that have natural folate. And these would be black-eyed peas, mung beans, pinto beans, chickpeas, lentils. Look at dark leafy vegetables. Yes, dark green veggies. And some of them can be spinach and all the different lettuces, right? Turnips, I guess, broccoli, cauliflower, Brussels sprouts. I guess not all of these are green, but your green leafy vegetables, avocado, mango, oranges, asparagus, okra, and I don't eat this, but probably we should, liver, not our liver. And I do have a guide that is on my website, the MTHFR, ADD, ADHD, and Autism Spectrum Connection Protocol. And I have some recipes in there. So I also have MTHFR recipes, which is using some of the things I just said, putting them in a lovely recipe for you, nice and tasty and healthy. So that's another thing is look for MTHFR recipes that use the foods that are high in the natural folate. This is really important because the folate that's in food is already methylated. It's already in its natural form. So you don't need the MTHFR enzyme. It doesn't matter if you have the MTHFR, mutation, right? So if you're taking in the folic acid, then you really can't have MTHFR. So do you see this one simple change? And I talk about this in my podcast all the time. And this is why if you're ready to make big changes in your life, definitely contact me. There's no doubt about it. It's sometimes just the simplest tweak that is like life-changing. And I'm going to get into why I'm telling you this is life-changing in a minute. But that's the first step it's the first 2 steps. The first step is avoid synthetic folic acid at all costs. Please turn over your vitamins because this is life-changing. A lot of the vitamins will say folic acid. Don't take it, don't buy it, don't give it to your kids. If you see folic acid, you want to see that 5 methylfolate, and you want to definitely see the B12 methylcobalamin. A lot of people take B12, right? Because they're deficient, they're anemic, they're not processing it well. If you're low in it and your doctor's giving you B12 and you're taking B12 cobalamin, think of the craziness of that. You're not fixing anything. So if you're MTHFR, you're low in B12 and you take cobalamin, it's not fixing anything because you might not be able to process this cobalamin, this B12. So what you really want to do is if you're MTHFR, you're B12 deficient, you want the B12 methylcobalamin. And you want to make sure that you start avoiding folic acid. So you're going to push that system, you're going to support that system by taking out the folic acid and putting in the natural folate. It's really simple things, but again, changes the pathways in the body immensely. The other thing I did talk about, which I absolutely love, is the third step, which is to test for nutrient deficiencies. We just talked about B12. Do you have a B12 deficiency? That affects a lot of things in the body. And a B6 deficiency does too, folate as well. And glutathione does. Cysteine, we test for that. Actually, you need to make glutathione. So we want to make sure cysteine's working, glutathione's working, folate's working, B12 and B6. We also want to make sure, obviously, all these other vitamins are working. But right now we're talking about MTHFR, so I'm just kind of sticking in that realm. Our micronutrient test provides levels both inside the cell and outside the cell. What that means is we follow the medical model, and when you get your blood drawn, we're going to give you what your level is of, let's say, vitamin A, D, B, all the B's, like C's, you know, your iron, all this stuff, over 30 nutrients, vitamins, minerals, antioxidants, amino acids, omegas, stuff like that. And we're going to draw your blood, and we're going to give you what your level is, a snapshot in time of that's floating around in the liquid part of the blood. And this is outside the cell. This is in the liquid part of the blood. And that's the medical model. When you get your blood drawn, you get your vitamin D tested in the medical world. It's a 24 to 48 hour snapshot in time of what your vitamin's doing at that time. Functional medicine, and with our micronutrient test, we go one step further. So we do the medical model, but we do a functional model, which is we look inside the cell. And it's looking at your nutrient levels, your vitamin A, your vitamin D, your B6, your folate, your zinc, your selenium, your magnesium inside the cell. That's a snapshot in time going back about 4 weeks, 3 to 4 weeks. It's a longer time to really say, how long has this patient been deficient? What's going on here? The snapshot in time's tough. We use those as, an idea to I use the medical model to basically take a periscope or take like a little binocular and look really quick. I always consider myself above the water. You have a big iceberg in the water, and I'm just looking at the top, and I only have a snapshot of 2 days of what's going on right now. What could be the problem? Now, it could just level out. A lot of, blood levels that you test something on a Monday, and the following Monday they're different. So that's why I like our micronutrient test, because we test inside the cell. And I can really see, oh my gosh, I'm going back 4 weeks. This has been deficient for at least these 4 weeks. Could be months and months and months. I can't go that far back, but at least I can go back far enough to say it's been consistent over the last 3 weeks, the last 4 weeks. I know this is an issue. So the micronutrient test, the functional one, is tremendous. And to do that with MTHFR is giving you so much information, because what you're doing is you're saying, okay, I have an MTHFR mutation, and then the very next thing is we're going to pull up the micronutrient test and look at these cofactors that are at risk for an MTHFR mutation. They're at a risk for not working properly. They go off into your body, and they affect so many pathways. If I was doing your neurotransmitter test, which is the next test that we're talking about, let's get into step 4. The neurotransmitter test is testing serotonin, dopa, GABA, melatonin, serotonin, norepinephrine, epinephrine, all of these things that when people are not focused, not paying attention, ADD, ADHD, they're depressed, they're sad, whatever's going on, anxiety, they want to give these medications. And I see a lot of people giving SSIs, serotonin, they're giving serotonin. Even functional medicine like myself, I see people giving serotonin in supplement form, or they're going to give, tyrosine, tryptophan, 5-HTP. I have people come in my practice are taking so many supplements. So we have the medical world throwing so many serious medications at this, and we have the functional medical world throwing so many supplements at this. And what I like to do they have MTHFR? I first need to know that, because if so, it's usually more compromised than someone who doesn't. And I kind of have a tougher case there. Then I want to look at the micronutrient test with the neurotransmitter test. So if I'm looking at epinephrine, dopa, GABA, 5-HTP, serotonin, I'm just not treating the symptoms. So if serotonin's low in the patient, I'm just not going to give them more serotonin. What I want to do they have MTHFR? Then I definitely want to go look at the players, which I call cofactors, that you need for, 1, these pathways to occur, and 2, to make these neurotransmitters. That's the key right there, right? So if you need B12, if you need B6, if you need iron, if you need copper, if you need glutathione to methylate, if you need these players, and I'm just mentioning a few, you want to go to the micronutrient test and say, all right, and you want to compare the neurotransmitter test. That's step 4, is to test your neurotransmitters. and look at it all. I lay it all out and I look at the pathways. I look at every single step. So I'm going to look at something that's going to go from, and I talk about this in my blog. If you want to go to my website, I do talk about neurotransmitters on my blog. There's lots of podcasts on it. This is where we get really deep. So I'm now not looking at the tip of the iceberg. I'm not looking down at the iceberg on the water. I'm literally scuba diving down or for you and looking really deep and looking at where your deficiencies are. Then I'm going to compare it to the neurotransmitters. If you wanted to go that deep, we're going deeper and deeper. You don't have to. You can just fix your deficiencies. But some people do the neurotransmitters test with it. I'm going to give you a quick example because I want to move on to my last step. And I always promise to keep these nice and short for you. But I want to give you a quick example. And I'm pulling this out so I can make sure I get it completely accurate, because sometimes coming from memory, we don't. I'm just going to give you an example because a lot of people use serotonin as an example. The serotonin pathway or the melatonin pathway. You know, a lot of people take melatonin to sleep, right? It's we've heard about this. And I just want you to know, when I talked about melatonin in 1998, nobody would take it. They were terrified of it. Doctors told people, don't take it. And there was all this stuff, coming out that it was dangerous to take melatonin. Now it's just everyone's taking it. It's this. There's so many things I could tell you that I used to talk about coming out of a chiropractic school that we would talk about, and especially moving from California to Jersey. And then I'm talking with patients, and my doctor told me, oh my gosh, don't take that. And I was like, oh, it's crazy today where, now you just go by anywhere and you take it. So melatonin, everyone knows now. I don't have to explain it. But what I want you to understand is the pathway starts with tryptophan. And that's another thing that people take. We test tryptophan in the neurotransmitters test. Want to know your level. Do you really need to take it? I have people taking tryptophan and their tryptophan is so high. I'm like, you don't need more tryptophan. It's fine. So for tryptophan to turn to 5-HTP, a lot of people take 5-HTP. Again, if it's fine and it's not low, don't take it. Because you're just going to get stuck right here on this pathway. But to get from tryptophan to 5-HTP, you need iron, you need B3, you need vitamin C, you need vitamin D, and you need a couple enzymes in there. And you need the active form of folate. You need MT, which they're going to call MTHF, right? It also can be, you can see it many different ways, but you need folate. So if their tryptophan's low, or let's say their tryptophan's high and their 5-HTP's low, I'm going to look at, yes, tryptophan level, yes, 5-HTP level, but I'm going to look at iron, MTHF, the natural form of folate, B3, vitamin C, and vitamin D. And I'm also going to look at MTHFR, right? So do you see how all of this plays into part? This is just the neurotransmitter pathway. Your B vitamins play with so many other things. Your B vitamins are important for energy, focus, anxiety, all like neurological stuff, but it's also super important with thyroid. If you have a thyroid problem, we have to look at your B vitamins. And then we have to go to the liver for all of this and make sure everything's detoxifying. So I'm just giving you one little nugget into what I do and why, booking an appointment with me is really crucial to try to figure some of this out. I am giving you the simple protocol, but I'm here to take you deeper. This is like me scuba diving, holding your hand, and we go down deep and we look. And I never know what we're going to find either. So I'm here to look with you. In order for, let's say, for your dopamine to occur, dopamine, everyone hears about that. You need the same things. You need iron. So people might take tyrosine, right, to try to push up their dopa. But you also need the same thing. Iron, you need the natural form of folate, you need B3, you need vitamin C, you need vitamin D. You need those. So if you're having problems along these pathways, you really want to look at your MTHFR, your micronutrient test, and your neurotransmitters. I like to support methylation with MTHFR vitamins. So one of the things I asked you to do in the beginning was to avoid synthetic folate at all costs. And I'm sorry, I'm going to be going over that. We're going to be going over that. I love to keep this at 20 minutes for you, a tiny bit over. I will wrap this up. But I told you to avoid synthetic folate at a cost. I told you to pull out your vitamins and start reading. You don't want to see folic acid. You want to see methionine. So what I like to do, and this is something that I am not telling you to do. This isn't treating you through a podcast. This is something that you would meet with me and I would work with you, is to support the systems with methylated MTHFR vitamins. So if you're picking the vitamins, make sure it's got the MTHFR forms, the correct ones. I also like to support neurotransmitters with collagen peptides. And in my MTHFR, ADD, ADHD, and Autism Spectrum Connection Protocol Guide, it's on my website, I do show you the ones that I feel. I'm a bit of a brand snob because I like brands at work that, I test and retest. So this is what I'm clinically sharing with you, that these, the ones that are here are ones that work really well with my patients. The last step that I want to share with you is to make sure that your medications are MTHFR compatible. Not all medications work with MTHFR genetic mutations. This is not the area of my expertise. I don't know a ton about this. There is a blog. It's called My Journey with MTHFR. And I do have the link in my guide, in my protocol guide. She has just an amazing list of medications that might interfere with MTHFR, and I think it's good to be aware of it. I really do. I think it's good to be aware as you're moving forward. When I put people on thyroid medication and they can't have gluten, we need to be aware of some of the medications that we take. If there's heavy metals in the medications, like when we do talk about vaccines with kids, we do need to be aware. I make the parents, if your child has an MTHFR genetic mutation, you don't want to be bombarding 72 vaccines all under the age of 5, because they might not be able to get rid of the heavy metals, and that could affect the brain. So, you want to break those up, and you want to do those in a way more safe manner. So you need to be aware of MTHFR with MTHFR mutations with medications. And another example is an RA drug, methotrexate, doesn't do well for patients with MTHFR. And in this case, the doctor just uses another medication. So it's not that you can't do medication or you can't do vaccines, but you really need to be aware of what you could possibly, a big mess you can possibly getting yourself into if you don't know that. So the crucial MTHFR factors are definitely, make sure I'm going to summarize this for you. The protocol is avoid synthetic folic acid, start reading labels on foods and supplements, and make sure that you're using supplements and eating foods with natural folate, and also check out B12. You do not want cobalamin, you want methylcobalamin and methylfolate. Start eating natural folate, and I mentioned those. And check out, if you, with me, book a visit and let's do a micronutrient test. And we're going to test out over 30 nutrients, including the cofactors for folate, B12, B6, glutathione, cysteine. And if you wanted to go even deeper and if you're having problems with MTHFR, if you feel like, yeah, I'm one of those with ADD, ADHD, I'm one of those with, sensory anxiety, I can't sleep, there's something going on with my neurotransmitters, you can also dive even deeper and do the neurotransmitter test. And always be aware, check out the medications. You can even Google which medications are compatible with MTHFR or not. That's something I just think is super, super important. So I know I went over the time today. I apologize. I always try to keep my podcast with a nice short bites of information that you can absorb while you're listening, driving, cleaning, and it can be retained in the brain. Again, this doesn't replace your medical care. This isn't a treatment. This is just absolutely glorious educational information for you. And go over to my website, grab my protocol guide so you can see a lot of the things I'm talking about, and not just audio. And book a visit with me if you need any help. Have a glorious day. Thank you.